colonialism.
We have to unlearn.
Shall we begin? Let's begin now.
Somebody ought to do something about that.
What would Quay say?
Is this the oppression Olympics?
Decolonization.
It's the data.
The revolution will not be televised because it is starting with infants and toddlers.
Welcome to Get on the Early Childhood Bus, where we break down everyday issues affecting our youngest children. We're going to meet you where you are and take you where you need to go. So get on the bus and be prepared for a journey that takes us down a path that examines our systems and applies child-centered solutions to give kids what they need to thrive. I am your driver, Penny Smith from Erikson Institute in Chicago. Each episode will be joined by our co-pilot on this bus, Cristina Pacione-Sayas, who also works with Erikson and happens to be a state senator in the Illinois Senate. To take you on this journey, we have 3 guiding questions that will help us get to where we need to go. Where did we find the baby this week? This centers around a topic that needs our attention and needs to center the well-being of a child. Who are the fire starters or firefighters? This question helps us think about who is accountable for the issues and who can help provide solutions. Whose worldview am I centering? This reminds us to always look at this issue from a variety of perspectives and not just our own, because there's an ocean of experiences out there and everyone's is different. So now that we've mapped out our path, let's hit the road and get this bus moving. Miss Christina, where did we find the baby this week? Where are we going on this bus?
This week is a carryover from something that happened the week of March 22nd. The General Assembly passed some legislation, the last pillar of the 4 pillars that the Black Caucus's legislative agenda, really going to get at so many different issues that we have in the healthcare system related to the operationalizing of racism in our system and how we need to really just pull that out at the root and get at these social determinants of health. I know some of our guests later are going to talk about that. But the baby is found in several parts of this legislation. One around doula services.
Okay, so tell me about that. Can you go into a little bit more detail about that?
Yeah, so a doula is the definition of the word is mother, the mother of the mothers. It comes from a indigenous tradition and practice of there being a mother of mothers while a woman is carrying a baby and laboring and delivering the baby. Also very, prevalent in African countries. I mean, it really goes back to our roots.
So it takes a village. Is this all part of that kind of concept, right?
Yep. When you do have somebody that is accompanying you on your journey of pregnancy and then labor and delivery and then postpartum, there are better outcomes for moms with respect to staving off postpartum depression, supporting healthy recovery, being able to flag if there's something that is, potentially going wrong, supporting with if you're able to breastfeed, so many things. And so we're looking to have an expansion of doula services in our state. We're looking to support their certification. We're looking to couple it with home visiting. So again, we can think about there being a connection between maternal health as well as child health, but also knowing that this is a really critical resource to stave off maternal morbidity and mortality, which is disproportionately present specifically in Illinois, in the Black community, where you have 2 times the rate of Black women who are dealing with maternal morbidity And unfortunately, that can also lead to maternal mortality. So point is that this is huge, big investments around bias training for the medical field, requiring that so that we can start to get at some of these implicit bias that folks adopt and how the system in some ways incentivizes those biases. So we've got some good stuff coming down.
That's great.
Right.
That's great news. Great news. So I guess that kind of leads us into our next segment. If we were to try to identify the fire starter or the firefighter in this, and let's first kind of have you go into why we want to frame it in that way. And fire starters and firefighters, give us the origin of this segment and the background on why we're going to try and address accountability and root cause for these issues that we bring up when we're trying to find the baby.
So my new BFF, although he doesn't know it, is Vu Lee.
Your friend in your head?
Right. He manages a website called nonprofitaf.com, and you can fill in the AF. He put out a blog, and it was really about a wake-up call for nonprofits and foundations to get political. And, he has some very specific messages for those folks, but he uses this amazing metaphor of the work that we do in nonprofits and what foundations tend to fund is, instead of us addressing root causes of the issues we're trying to tackle with X initiative, Y program, Z investment, we end up spending a whole bunch of time treating symptoms. We will write a white paper, we will do trainings, we will do workshops, we will do everything to accept the fact that it's okay to have fires, instead of asking, why are we not going to those fire starters and taking them out? So I just want to pay homage to Vu Lee. And, Vu Lee is also a nonprofit leader who identifies as Asian, also LGBTQ. I just think it's really important to, lift up and center his perspective, his worldview, so to speak, and what contributions he's making to how we think through and frame this work.
And I love a good metaphor, so I'm loving this one. So then let's talk about this pillar, the health pillar. When you talk about doulas and you talk about maternal health, first of all, let's start with, who are the current firefighters?
Because of COVID and how it has disproportionately affected communities of color, you've got your advocates, you've got your community health clinics and your federally qualified clinics, you've got community health workers. Those individuals are really trying to tackle the conditions that our community members are experiencing and connect them to better access points within the healthcare system, to translate information for them so that they can better navigate, to accompany them with being able to access services, all of that. So those are the folks that, they're tasked with supporting efforts to get people connected to some basic resources.
Okay. And so now that we know who is putting out the fires, who's starting these fires? And maybe we need to start with identifying exactly what the fire is. We know we have this issue that you brought up in terms of, in Illinois, twice the rate of Black mothers are experiencing maternal morbidity. And so why is it like that? What's causing that to be the case?
So many different origins, but I mean, let's call it what it is. The institution of medicine has historically been anchored in white supremacy. And not only white supremacy, let's think about this as the three-headed monster: white supremacy, patriarchy, and capitalism. So when those three come together, even though you have well-intended individuals within the system and working towards getting folks access to better healthcare and supporting their needs, the system incentivizes certain things. whether that is, how we document and code services. Some things are doctors can, get more money by coding in a particular way or adding additional services. There's, you have a big influence of the, pharmaceutical companies. You also have certain areas where there's service deserts that do not have high quality healthcare and access points. And then historically, our communities have been mistrustful of the medical industry because of what's happened to us in the past in terms of being experimented on for certain drugs and certain procedures. They call this, right now, vaccine hesitancy, right? But call it what it is. It's mistrust in the system. And let's not blame people for having quote unquote hesitancy. Let's go back to the root cause why people are questioning.
Right.
Specifically, if we're going to talk about maternal morbidity, mortality, specifically in terms of the outcomes for Black moms, there's so many stories, right? And, you think about one of the most prominent ones was Serena Williams and how she almost died because she kept on having to insist that something was not right. She wasn't being taken seriously. She wasn't being attended to. And she really had to not only endure whatever she was enduring physically, but also have it within herself to advocate for herself. And that's somebody who is well-resourced and obviously people know who she is. So just think about your average mom.
And, something else that comes up for me is this idea of pain thresholds that doctors have been either trained or thought to think that Black people have a higher pain threshold. And so, I think about the doctor, I can't remember her name right now, but most recently she passed from COVID, complications of COVID in Indiana, where she didn't feel like she was getting the services that she needed. And she was telling the doctors what she needed at the hospital while being treated. And she recorded that she wasn't getting those services. And, it's kind of dismissive. And I can hear my mom talk about her visits at doctors where she feels like they're not taking what she's saying seriously. And so that does contribute to the mistrust. And so I'm wondering if we can talk about like access to services, but once you get access to the services, then what? How do we dig even deeper to figure out what the root cause is and who the actual fire starters are? And then how do we, instead of trying to appeal to someone's moral code, make this more of a policy or part of the ethics? Like that's a big thing amongst providers as well. And I'm not trying to put all of it on providers, but that's a good portion of it. And I think if we don't address it, it makes me think of who our guest is going to be later on, Dr. Tina Sachs, when she talks about racism as a risk factor, not race. So many times we talk about race as a risk factor when it's really racism as a risk factor. And those things come to mind for me.
And that's going back to the system, flipping it on its head, because oftentimes we want to assign characteristics as risk factors instead of pointing to the system that incentivizes the outcomes and behaviors that racism expresses itself in.
So who should be the firefighters? We know who the current firefighters are, but now that we've identified who started the fire, come on, who are the fire marshals here?
Well, I think where we have some opportunity is both in the health pillar, House Bill 158, and also our other guest, Senator Aquino, him talking about the Health Care and Hospital Transformation Act. Both of those pieces of legislation are centering community voice and direction for solutions.
Okay.
So those are the fire marshals. When we want to go into problem solving, we need to bring the folks who are closest to the problem to the table to help design a solution.
There we go.
With the Healthcare and Hospital Transformation Act, that's, $60 million that the state is putting in to draw down $90 million of federal money so that we can design at a community level the unique response to these social determinants of health in ways that we probably haven't done in the past, that are more organic, that are meaningful, that are community determined. And then the same on the health pillar, there's a whole initiative to create a Medicaid technical assistance space to better support providers with navigating Medicaid, with meeting the needs in what they call these quote unquote service deserts.
Mhm.
So think about it, it's like multi-level. When we're trying to go after the fire starters, we need to think about, how do we tackle on a personal level? How do we tackle on an interpersonal level? And then how do we tackle on an institutional and systemic level? I mean, this is also the same levels that we discuss in terms of tackling racism. You have to tackle it on all fronts, because the anti-bias training obviously is trying to tackle on the individual level, but also how that plays out on the interpersonal level. But because it's in statute, it's now at the systemic level. It's mandated.
Right. Well, thank you for that trip, Senator. What we're going to do is introduce our guests. For this next segment, we always ask the question, whose worldview am I centering? And for our first podcast that we release, I thought it would be interesting for our audience to kind of know what our worldviews are, so that they can understand what lens we're using when we discuss these issues. And so, I'll start off. My worldview that I bring to these conversations are that I am an American descendant of enslaved Africans. I grew up with a single mother. I grew up in daycare from the age of 6 weeks, moved every year until junior high school, where I had to make new friends every single year. So, I call it an advantage. I had the advantage of having different worldviews that I came across in growing up in that way, and interacting with many, many, many different families along the way in those daycare systems. And I have no children, but I love the babies. I also come with a very process-oriented brain, so I'm always trying to dissect the process and identify the root cause. And there's deeper stuff, but I think that's a start. So, Christina, why don't you share what your worldview?
I think I always start with, my parents, how being an only child of two community organizers. My dad was born in Puerto Rico. He came here when he was 4. Speaking of, for a medical issue, because my uncle was born without limbs, and Puerto Rico's health system obviously could not, meet their needs. So when they came in the 50s, during kind of like a mass migration from the island to Chicago specifically, they came to get medical attention for my uncle. They grew up in public housing in Lathrop Homes, which right now is in a contentious battle around gentrification because it's now a quote unquote hotspot in our city. My mom is Italian. She's one of 10, definitely kind of like the renegade of her family. Grew up in a very strict, religious, traditional Italian family. She left the house before she was married. That's like totally, she took off to Europe. I don't even know how she did that. Ran amok over there, and then came back and went to college as an older student, and then later met my dad at the Boys and Girls Club. She was a photography instructor. My dad was managing the gym, and they worked their way up and became executive director, program director, and then bam, here I am. For me, I grew up in the context of community, and community is family, and having really the club being my home, understanding all of the work of building community, bridging community. Our work is not just programming, but it's also protest, it's also negotiations and gang truces, all of that. And then I think another important lens to add to that is my mom became disabled when I was 7 years old. And, that totally introduced me to a whole nother world perspective about this country and how it's structured in a way that is not universally designed. That all of a sudden you have somebody like my mom who was so prominent in the community, loved in the community, but because she was using a wheelchair after she had, a good 6 months of recovery, people started to treat her in a particular way, as though her intellect wasn't as, keen as it was, as though she needed to be spoken for. So constantly having to kind of speak up and navigate that whole piece, and the discriminatory practices against people with disabilities. So that really was my formative experience. But I'm also a mom. I have two amazing young human beings. I have a 6-year-old and an 8-year-old, and these two love to check me. I'm definitely trying to raise some free people. I also have to say, what is another interesting lens that comes to the mix. My husband is Puerto Rican, but definitely identifies as Afro-Puerto Rican. And so you also kind of see, again, this from the race and ethnic lens, how all of these intersectional experiences come together and form and inform how we show up in this world, who we bond with, and how we advance a collective agenda for liberation and humanity. And so, that's just a little piece.
All right. So we'll get off at this stop on the bus and go to our next destination, where we meet up with our special guests. Let's go.
As I mentioned, we have guests for today's episode who are going to help us dive deeper into health disparities. We have Dr. Diana Derige, who is the Vice President of Health Equity Strategy at American Medical Association, and Dr. Tina Sachs, who is an Associate Professor at UC Berkeley's School of Social Welfare and author of the book Invisible Visits: Black Middle-Class Women in the American Healthcare System. Diana, take it away.
So, Tina, we're sitting down today and talking about maternal child health, race and racism, where we are at this moment in history with the COVID-19. There's so much to unpack. We don't have a lot of time, so I'm going to just jump in. And one of the things that we've talked about a lot, and I know Penny has talked about, and we've talked about Black Mamas Matters have said this, the National Birth Collaborative said this, that it's not our race, right, that determines this, it's the racism that is really the issue, right? And I want you to unpack that for me. Like, what does that mean? Because people talk about it. I don't think people fully understand what that means and how they all come crashing down on a mama's head, on a baby's head, on a family's head. So I'd love for you to talk to me just like what that means in real terms, like how you see it in your work that you've done in your own family, how that may show up.
Sure. So thanks so much for having me and asking these really important and deep questions. So when I say, and a lot of people in this public health and social work and sociology and the kind of the social sciences have been really pushing us to think differently about how we use these terms race and racism. And so the first thing that I want to say is that I'm very troubled by the way that race is used in research and the way it's reported in health studies and in studies of health disparities and health inequity, because it somehow suggests that race, when people say race, when we're talking about social science, what they really mean is people who have been racialized as non-white. That's what they really mean, because white people are also a race, but nobody ever thinks of them in that way. So what they're really talking about are people who've been racialized as non-white. So Black, Indigenous, Asian, Latinx. So there's that. The second thing is that race is not a biological construct. It doesn't really have the biological meaning that people attribute it to. And so when you see that, race is a risk factor for low birth weight, there's sort of this sort of underlying implicit assumption that it's just because probably like Black people are inferior and Black bodies are just not as good. And it doesn't take into account the incredible impact of structural racism. And so when I say structural racism, what I mean is Black people are not just living in distressed communities. Black people are disproportionately living in communities that have been disinvested from. This is an active process of not investing in a community in terms of jobs, in terms of stores, in terms of shopping, in terms of environmental racism, right? So Black people and other people of color are disproportionately living in communities that have poorer air quality, in which, that's why we see these crazy rates of asthma among lower income people of color. None of these things are accidental. They are actually what one would expect from being systematically not treated well, and not treated well by the society, right? Not having schools that are, when you fund a school system through property taxes, you are going to make sure that poorer people are not going to have access to a good education. We know that that is directly related to health outcomes. So that's how racism works. Residential racial segregation, particularly here in Chicago, we know we have a long legacy of people being redlined, not being able to live where they want to live. And that intersects with not having the kinds of jobs that they want, not having access to a high quality education. All of those things are what determines our health. And that's why what we need to be more careful in our language and say that it's racism that produces these different outcomes that we see by race. So we see that there are different health outcomes that vary based on people's racialized identity in the United States. So whether one identifies as Black or Latinx or Asian, Indigenous, we know that those differences are real, higher rates of asthma, of other chronic health conditions, low birth weight, et cetera. But what produces those differences is not something inherent to the biology of Black people and other people of color. It has been produced by a society that devalues certain kinds of people. That is a very critical part, I think, of differentiating when we say race as a risk factor versus racism as the risk factor.
I appreciate that. We've talked a lot about like racial essentialism in healthcare, where it's kind of like, well, that's their biology, right? Which also American culture loves to make it individual, right? Like somehow it's something I did wrong or my family did wrong, and that's what it was. So I think that's great. The devaluing, I think, is really interesting to me, because that's the other thing, right? In the cry, especially in maternal and child health, was like, listen to Black women, listen to moms. And I think that that's been one of those rallying cries, because, and not to make this too personal, but my own story, right? Like, I thought that I had done something wrong. I was a professional MCH. I had a baby. I ended up with preeclampsia. I didn't know what to do. They kept telling me what to do. And then I started to find out that my story was not original, which made me feel like I was part of a group. But then also all my training came into place to be like, wait a second. So this is systemic. This isn't that this happened to me this one time. It's not just my baby. And so what do we have to do about that? So I think I'm glad that you bring that up and talk about that, because I don't think we talk about it enough. I think we're told like our story isn't valued as much, and that somehow we did something, right? That's very much central, which goes against my collective, how I was raised in my collective nature, which says we're all in this together, right? So when I think about listening to mothers, listening to communities, and listening deeply, because if there's generational work here too, right? Like, it isn't just like what happened to me yesterday. So can you talk to me a little about that? Because that I think is important, because we don't talk about that. Also, I want to just frame that I think that a lot of times in American society, we don't want to be victims. No one wants to be called a victim because there's something bad and negative about it. And again, you've done something to make yourself a victim. But I would love for you to talk about the generational and how that plays out, because I think that that's really important. And I think it helps people understand even how they're feeling.
Sure. A lot of my interest in this comes from some part of my own personal story, and also about a woman that I happened to have this chance encounter with, who made me think about, how do we think about our ancestors? How do we think about the meaning of our ancestors and how they have paved the way for us, and also the harms that they endured and how those harms may be affecting us in the present, right? And so just to provide a little bit of context and a story here is that the woman that I met, her great-grandfather was in the Tuskegee syphilis study, and her family believes that he died as a result of his involvement in that study. And it had profound implications on her life in terms of how she mistrusted healthcare providers for very good reason. And it changed how she engaged with doctors, even in this situation that was very acute with her daughter, who had an acute appendicitis, and she took her to a hospital and they did not have a Black physician. And she was just like, I cannot consent to this surgery because I'm afraid of what might be done to her. And then also was afraid that if she didn't consent, that she could die. And then she's in this terrible conundrum of, I'm afraid of being treated, in a predominantly white healthcare institution. And I'm also afraid, what if I make a mistake? What if I lose my daughter based on my own decision-making here? What if I, the challenges of being a mother, of being a parent, of having to make those healthcare decisions and not knowing what to do. And this was a real weight that she carried. And thankfully in this situation, her daughter was okay. But it really caused her to reflect on the heaviness of her own family history. And then, of course, knowing that her family history was not, just individual, that it was a story that happened to many Black families, and that for her, Tuskegee was really just an example of something. It wasn't just that she was thinking only about Tuskegee, but about the ways that she felt unsafe in general in this society as a Black woman with, small children. And it really got me to thinking too about my own story, about, my origin story and my ancestors. So my mother is from Mississippi. She came to Chicago during the Great Migration, and she grew up in the Jim Crow South and just endured all kinds of traumas and indignities, and came from a long line of people who had done the same. And then on my father's side, my grandfather was from Odessa, Ukraine. My grandmother was from Minsk, Belarus, and they survived pogroms. Then their extended family, they were Jewish. Their extended family also, the ones that were able to come to the United States, came during the 19-teens, and the rest of them perished in death camps in Europe. And so that's my story, my origin story of being a person, an African descended person, and also a person whose other side of the family was also hunted in Europe. And so it makes me think about the ways that we carry that trauma, certainly, and also that resilience. And there are a lot of writings, a lot of people, Karina Walters is an Indigenous scholar who I read and love a lot. And she talks about, that bodies, they don't just have trauma, but bodies tell stories. And our bodies, as the descendants of so many people who have endured many, many challenging things, there is certainly trauma that I think undoubtedly affects our health in the present. And there's also a way of surviving, a way of knowing, a way of being in the world. The saying, I believe it's a Mexican proverb, they tried to bury us, but they didn't know we were seeds. And that's kind of how I think about it. Like, they keep trying to stamp us out, but here we are. So it's both a story of trauma that is real and I think needs to be acknowledged, and also power and resilience and creativity and ingenuity and all of that.
I love that proverb. It was funny because I remember that proverb, ironically, with the Tupac poem, right? That talks about a rose in the sidewalk, that how a rose emerges. And so I think we hold those stories. I mean, again, I was raised with the collective knowledge that everything that I do now is really for 7 generations ahead. And it's hard. And that means that my grandmothers were thinking of me and working for that, and all that they endured, like that gets embedded in who we are too, as well. So as we talk about how we center worldviews, how we center stories, and we get rid of these malignant narratives that are really damaging to us because they become policy somehow, right? Even though they're falsehoods. What would you say if you had to change something or do something different to change those narratives, to center a different worldview? What do you think we need to do?
I think, we have to kind of approach all of these, social problems from both a policy perspective and also from a cultural perspective, meaning, this is where I really see the power of the arts, of artists, of activists, of storytellers to come and say, like, this is our story. I'm centering this kind of voice. And so those things can be amplified and put out into the culture in a way that academics can't do. You have to touch people's hearts and minds, and you also have to create policy change. And I feel like all of those things have to be done simultaneously. For example, I've talked to a woman in the Bay Area who was doing a documentary on her fight for childcare. And just how powerful that was, that she wasn't able to get childcare for her child. And then that was, it has all of these cascading effects for working women and working families. And she got together with a filmmaker and they decided that they were going to take this fight to the state capitol in Sacramento, California. And that they were going to tell this story of what this is really like for women who work, and to get out there and try to change it using film. So using a different medium to tell a story that is often ignored. And so I think that's really important. I think working on the culture and just like putting out more stories from, centering women, centering people who are, trans or non-binary. We have a whole new lexicon now of how people identify. So to center all of those stories, and also as we're thinking about women and mothers, to always be thinking about people who are living with disabilities and mothering and parenting. And so just to put all of these narratives out there and to try to make those narratives more, normal, quote unquote, than the perfect mom making all the perfect treats for their kids. And
yeah, if I hear balance one more time, I'm going to lose my mind, especially in a pandemic.
God.
It's like I haven't figured it out, right? Like it's this magical thing.
I mean, it's absolutely absurd. I'm like, you know what the balance is that I need? I need some more childcare.
Exactly.
And I'll make you all kinds of perfect looking cupcakes. Okay.
Exactly. Yeah. Once I let go of that, once I let go of trying to feel so inadequate because I wasn't balancing, it became much easier, right? Just to be able to okay, this is how we're going to function and
That's
be okay
right.
with that. Right. Exactly.
No, there is no balance here. It's like, we're all trying to keep our jobs. I feel super fortunate to be able to work from home. I mean, many of us do not have that luxury. So, and at the same time, it's super hard. It's luxurious and impossible.
Right. Exactly. Right. It's an extra layer of work on that. No, what I really appreciated too is the TRHT, right? I'm all for, truth, racial healing, transformation, reconciliation. I think those are great. Changing minds and hearts are very important. And also until we get there, we need that policy, right? Because it needs to strengthen that muscle. Because people are like, we're going to talk it. I was like, great. We're all going to get there, right? But meanwhile, let's put these guardrails on because harm is really being done. It's not just this data. There are babies dying that don't have to. And so I'm really looking forward as we emerge from a pandemic and everyone wants to look at how we're going to do things differently, all the cracks we saw in the system, that all of us who have been doing this work in inequities knew that existed, right? But all of a sudden everyone's like, oh, how could this possibly be? And we don't have data and people are getting sicker. Oh, wait. And it's repeating itself with vaccine distribution, right? Right.
Yep.
These are, like you said, systematic patterns. They're not anomalies that somehow mistakenly happened. They wrote into the system. I'm really looking forward to the kind of re-envisioning, so what can we do, right? And if we start planning for this and we could do this right, I'm hoping that's my light at the end of this tunnel, right? It's okay, so we're going to reimagine the system for real. We're going to talk about this and what it means. And so looking forward to those days.
I'm so glad you brought that up because this concept of healing, it bothers me a little bit because it's you're trying to heal something that hasn't been even fixed yet. You want me to heal from what? You haven't done anything different. And
just so let it go. That happened in the past.
Yeah,
right?
You're okay. Let's heal from that. And I think one of the, and I wish I knew which post it was. I remember coming across an Instagram post where someone was saying it's like being in surgery. You're open, you're cut wide open. And somebody said, heal. I'm like, but I'm still, what do you mean? I'm still open here. What are you talking about? How can I heal if you're still cutting me? Thank you, ladies, so much for this. This is a really great conversation. I'm really hoping that we can begin to have these discussions that move toward, policy change, because like you said, you can talk about it and then ask us to heal, from something that we haven't quite figured out what the heck's going on. And then also one thing I wanted to bring up, if you don't mind sharing your worldview, whose worldview you're coming from, just so the audience can kind of know who they've heard from today, and sharing, we call them disclosures. I stole that from from Dr. Crawford. Shout out to Dr. Crawford if she's listening to this, where you just kind of share, are you a mother, race, ethnicity, all of those things. What kind of view are you bringing to the table today? Tina?
So my worldview is really shaped by, my lived experience now as a mother, as an African descended person, as a person who's descended from Jewish people, and a person who's really interested in trying to, first of all, to do anything I can to stop the harm, because you can't heal until the harm is stopped. So that's really important to me and really powerful to me, to try to stop the harm and then to heal myself and then to heal the world, which is a tenet of Judaism, tikkun olam, which is to heal the world. And, I really do feel like I'm working in the service of my ancestors, and also certainly, like trying to think about Dr. King, who talked so much about that service was part of what we're doing here, right? Like that we all need to be taking an active role in trying to do something, because there's just too much bad stuff going on that actually could be stopped. So I certainly also consider myself part of that extended history of activists, people who are working, trying to fight the good fight, John Lewis and so forth, and I.W. Wells. I'm just thinking there's so many people, and that's the point of view that I come from. I'm so grateful to be here. I'm so grateful for the education that I've been able to receive. And I just feel like a real responsibility to just try to do whatever I can to share what I've learned. And I certainly also come from a Black feminist perspective, which is everything I've learned has been, in community. So I've learned in community with other people, and that I really center the knowledge of lived experience, and that is really powerful and important. And that Black women being really dismissed in certain ways as women, and then certainly with the intersection of racism, and being Black, and the profound anti-Blackness in this culture. And of course, one of my colleagues was telling me the other day, I was sort of explaining to her like my childcare situation and et cetera, and she was like, just don't worry about that. That's not just you. It's just the world hates women. Just it's not personal. It's just the world hates women, and you Black too. So it's just so don't take it personal. And we laughed about it, but it is really true. And I feel that is also a certain kind of both responsibility, but also power. And I just try to walk boldly into that. And that's where I'm coming from.
Thank you. Deanna?
I don't know how to come after that. See, Tina? So at this moment in time, I'm coming from this worldview, this conversation, being blessed to have been surrounded by very strong women that I've learned a lot from. And so having these conversations has become more and more important to me as I've gotten older, as I've learned to raise some daughters in this world, because narrative, our storytelling histories, super important. And what's ironic to me is like having been formerly trained in public health about the data, right? We need the data, we need the research. And now we're starting to understand those stories behind it are more important, right? The qualitative stuff. All that stuff that they were like, oh, that's all noise, right? It's not noise. It is the story. And so I have been, especially in this pandemic, taught to listen harder and listen for those things. So as a mother, as I was raised at a certain time, so I'm going to age myself. I would identify, depending on the day, as a Chicana, because that has shaped who I am and how I see the world. As a Latina, as I mentioned before, I consider myself part of the African diaspora. And in solidarity with women, because it is intersectionality can be a bee, like it just comes down crashing on your head. It's like, oh, that's right, I'm this, and this, and this, and so the world's going to take this. And so it is a profound thing that I am trying to, at this moment in time, have a real conversation with a 4 and a 5-year-old. What does anti-Blackness mean in them? Who are they? Where do they come from? Where do they belong? And what is their role? And they're at children will take you to the very ends, and my children will do that. My children are very much Beyonce, who runs the world girls, and then look at the TV and be like, but why are they doing that, mama? Like, why is that happening? Why don't they like us? Why does it matter? What is, I think pandemic life has made me think about things differently as how we see the world. I am a daughter. I am a granddaughter. I am part of a long thread of history. And that and then I recognize that everything I do is for those that will come after me, is really important. and that I am one person that's having to constantly deal with white supremacy values in my workplace, right? And in the world, and trying not to succumb to them. Because, what are the other quotes that we like? Like Audre Lorde, right? The master's tools will not break down this house, right? So it's those kinds of things, like their urgency, like you all have to fix this. I was like, I wait a second. I can be part of that solution conversation, right? I'm gonna sit here with Penny and Tina, have that conversation, but y'all broke it. And actually, you didn't break it. You built it this way on purpose. Right. Don't ask me to fix it. I'm going to go over here and work with my women. We're going to do our thing. You all fix that. I diverge, but yes, that's where I come from at this very moment in time, and it changes day to day. And I think that's also part of living in the moment of a pandemic. Like my worldview changes because there's so much going on right now.
Thank you. Thank you. And I'm hoping that people listening to this will begin to understand that women of color are not crazy. I'm hoping that people begin to own how broken this system is, or not broken, how it was designed. And then let's start framing our language a little bit better when we talk about advocating for change and trying to make real changes. Let's acknowledge what's happened and that people are feeling this way for a reason. It's not made up. It's not being crazy. And so I appreciate you sharing your views, because I think that adds a whole lot of layers to this conversation. And I appreciate your time today.
Thank you for listening to Get on the Early Childhood Bus podcast. We hope you enjoyed our deep dive.